Hello, viewers, and welcome. My name is Philip, and I'm so lucky to be here today with Jennifer. And recently, we published an article about the Ottawa Hospital Simulation Patient Safety Program. And we got tons of feedback, so we thought we'd do a follow up article. So we brought Jen on. Welcome, Jen.
Hi, happy to be here.
Glad to have you. So, why don't you tell our viewers today what is the Ottawa Hospital Simulation Patient Safety Program?
Well, it's an exciting program that's been around for about 10 years. It's an in situ simulation program where we do simulations in the clinical environment focused on latent safety threats, so identifying threats to the system, to patient care, and interprofessional education and team training.
And what's your role?
My role is the nursing co-lead of the simulation patient safety program. And it's important to have the nursing voice in an interprofessional program. So we have our physicians, we have our nurses, but the nurses is a large part of our population. We have over 4,000 nurses at the Ottawa Hospital. And, you know, nursing is kind of the backbone to healthcare. We do a lot of the work in collaboration with a lot of individuals, but it's important that we're represented as well. So by being a member of the team, both by the debriefing team and in meetings, it helps represents that voice. And I have that link to the clinical environment.
I love that you brought up that collaboration, and I guess why is collaboration so important in your eyes, especially with something like this simulation program?
Well, healthcare that's what it's about. If we practice in silos, we don't have the best outcomes for our patients. So we need to communicate to each other, understand where we come from, how we support each other, and in the end, provide that safe patient care to have positive outcomes for our patients.
I love that. And I can tell the passion in your voice even before we met today online from reviewing the article. And so, I guess a good follow up is what got you interested in nursing, Jennifer?
Well, that's kind of a funny story. I sort of fell into nursing. It was my second choice when I did my application to university for my undergraduate degree. But I didn't hear back from my first choice, which was genetics, but that's okay. But I have no regrets. It's been a phenomenal career. I've worked everywhere from like a med surg unit all the way to critical care. Critical care was my favorite experience at the bedside. And I've just had so many diverse experiences with amazing people, patients, educators, staff, and it's offered me so many opportunities to grow. So, and then I fell into the simulation side. Well, that's kind of a long story too, but I'll just leave that short. I fell into it probably when I was training to be a emergency response nurse. So at the Ottawa Hospital, we call it the RACE team. And I did my first exposure to healthcare simulation training in 2010 and fell in love with it, and then had a long history to there. But no regrets whatsoever. I love what I'm doing and excited to keep going with it.
Excellent. Well, now that you obviously we're talking about a lot about your place, Ottawa Hospital, it sounds like there's a great culture of learning and a great culture of safety there. Do you feel that same sentiment that I feel hearing about from you?
I think so. We have a fairly robust program. We're in the process of going through incorporating the other health professions and supporting them. That's my new role, to support our allied health teams, so our OTs, our PTs, and help build some robustness around their education, focus mostly on simulation, because simulation is a really great avenue to test patient safety components, policies, protocols, things before we go into the real environment. That's why we exist, so that we don't have to do it on real patients. We have a robust nursing simulation program. We have over 54 educators that are trained. Our physician groups are fantastic. They have lots of programs. So it's really at the forefront, and it's one of our pillars at the hospital. So it's really important that we have that ongoing education for our staff, because once we graduate, we know we have that requirement for all our licensing bodies, but we also have the requirement as we keep going. So trying to provide those real-time opportunities as well, and ongoing professional development.
It's amazing. And you personally, with over 20 years of healthcare experience, has there been a moment in time that's been a turning point that shaped your current approach to being an effective leader and educator at the Ottawa Hospital?
Wow, I've had lots of different experiences. I really think it's had a lot of impact with the different mentors that I've had. I've had 4 mentors. I've had 2 physicians and 2 nurses. And each one of those influenced me in a different way. My first one was when I was in the ICU, really shaped how I deliver patient care on that patient-centeredness. Because, in the intensive care unit, you can become very focused on the tasks and the skills and forget that the individual is still there. even though they're sedated and so forth. So just really keeping it focused on the individual. My other mentor helped me when I first became an educator, really shaped how I deliver education on a patient-centeredness. And then my physician one, Dr. Posner, who is our director of our SIM program, our Safe Patient Simulation program, kind of took me under his wing when I first started in the simulation and really helped me grow in the simulation environment and kind of put me on that direct path. And then another physician really helped me with scholarship. So, when you think about a project, scholarship is really about sharing beyond your own organization. So really, when you do a project, what can you do to help share it outside of that? So I try to do that with every project that I do. How can I share it, whether it be a publication or conference presentation or so forth? So those have really shaped who I am as an individual. And I've been very beneficial from
Wow, it's
it.
amazing. It's great to see and hear how mentorship plays a huge role in someone's career trajectory, and it's very clear it supported you as well, and I'm sure you're doing the same with those around you.
I hope so. I that's one of my mottos is if one of my mentees can shine brighter than me, then I've done a fantastic job. And that's always what I try to do when I'm working, whether it be in a formal mentorship or informal mentorship.
Oh, great. I love that. That's a great way to end our short talk. Thank you for chatting with us, Jennifer. We really appreciate it.
Thank you for having me. Happy to be
A-
here.
And as Jennifer mentioned, if you're seeing this video, that means you just read this article, and there was a part one of this series with Dr. Posner, and you can read that one as well to learn more about the program. And if you and your teams have done some cool initiative like this, feel free to drop us a line and let us know about it. We'll put you in the spotlight too. Thank you, Jennifer, again, and have a great day, everybody.
Bye.